Visionable was founded in 2019. It came from many years of thinking and thought about digital collaborative platforms for healthcare. My co-founder and chief exec Alan Lowe had been thinking about this for a long time and been working out how it's possible to design a collaborative platform that works for healthcare and patients and clinicians, which had never been done before.
Visionable works with teams across the UK and around the world, implementing connective technology to make it more equitable and accessible for every person on the planet. Visionable combines next-generation video conferencing with unparalleled clinical imaging capabilities, allowing patients and clinicians to stay in touch, wherever they are and with all the required records, scans and pathology images at their fingertips.
As I say to people, we can go from the virtual hospital to the virtual clinic. On the way, we can redesign pathways so that they're more effective and efficient.
Visionable believe that affordable, high-quality, timely healthcare is a basic human right, and understand that a person's ability to get the care they need depends largely on their circumstances, who they are, where they live, and, in many places, whether they're able to pay. Visionable helps teams design new ways of working that put people at the center, to give everyone the best possible care wherever they are, whenever they need it.
We have a very clear purpose, our vision, which is to ensure that we can deliver healthcare to everyone, everywhere. And people might say it, but we've got the technology that actually can do it. And we know that the challenges for healthcare systems throughout the world, which effectively are about how you use the scarce resource, which is usually people, specialists, and how do you get access to healthcare for those people that need it anywhere. And that's really our driving mission, is to deliver healthcare to everyone, everywhere.
You're never going to digitize healthcare in the same way you have banking and transport. I think the whole point of care is there's a person that you look in the eyes, they hold your hand. That's still the essence of care. How do you digitize that? I think it's in small steps. I think you can take your measurements, your diagnostics and so on, and that can be digitized. I think you can access multiple appointments. So you could be seeing a doctor with 3 other people. That's a model we've never seen before. My belief is technology cannot solve the problem on its own. And the variable here is people. It's doctors, it's patients. Healthcare's complex. You can't go, there's one way for everyone. So if you look around the world, healthcare isn't the same. The human body is the same, but healthcare is not the same. So why do we have all these variations? And I think this is about working with the clinicians to develop services. Obviously, care is important, so that when you feel cared for by a clinician, it's not what they're saying, it's how they're saying it, has a massive impact. For us, we're looking at a common platform with the ability to tailor your experience and the tools you need to do the job you need.
Increasingly, healthcare will need to understand at depth what the needs of patients and citizens are, because, and I say that deliberately, most citizens don't want to become patients. So how do you prevent them from becoming patients? Understand their healthcare, and for that you need lots of data. So there's a data piece, but the data needs to be used in such a way that they understand the outcome of that use is better healthcare at the preventative level. So how do we prevent people from becoming ill in the first place? And how do we keep people in recovery from things like stroke, for instance?
Visionable. Request a demo now.